Hi everyone, welcome back to Feeding Ravendoodles, a pet parent's guide to nutrition. Today's topic is quick tips assessing your pet's poop. Now, everybody poops, and as pet parents, we're super used to watching our pets go and cleaning up after them, whether they go outside or in the litter box. It's very important for us as pet parents to monitor our pet's bowel movements and habits when they go to the bathroom. Most importantly, we need to realize and recognize what's normal for each individual pet because every pet varies based on what species they are, if they're a dog or a cat, what breed they are, and what they eat. So, since every pet's different, we have to be able to monitor our pets and know what's normal for them. We should know the normal color, smell, texture, and consistency, frequency, and quantity of each of our pets' individual poops. Many factors can influence how pets' poop looks and smells, like I mentioned. And some abnormal stool can indicate factors like disease, illness, or stress, while some other variations in stool consistency or color can have just indicate changes in diet or routine. It's important for you to check your pet's poop regularly, so multiple times a week at least, and note any changes that they have. You're definitely going to want to let your pet's usual veterinarian know if their stool is abnormal for 24 hours or longer, based on the factors that we're going to discuss next. Normal poops are going to be on a spectrum of browns, so they can be anywhere from dark to light brown. It's all going to depend on their diet and what they're eating. For this, but some abnormal poop colors that you might notice. First one being red. If you see like a bright red stool or streaks of red in the stool, that is definitely an emergency. That means that there's bleeding in their lower GI tract, so their large intestine, their colon, or their rectum. And you're definitely going to want to take your pet to the veterinarian immediately for this one. Another pretty big emergency for change in stool color is black. So black also indicates bleeding, but it can indicate bleeding in the upper GI tract, so like the stomach or the small intestine. Certain drugs can also change the stool color to black, so you're going to want to ask your veterinarian each time your pet gets a certain medication if it might change the color of their stool. Tan feces are not on the spectrum of browns, so these are a few tans that you might see, and these are also very abnormal. So tan feces can indicate problems with your pet's pancreas, liver, or gallbladder, and they should definitely be seen by the veterinarian immediately if you see these changes. Gray or white feces can also indicate similar things, so pancreas, liver, and gallbladder. It can also indicate infection or other disease, so you're definitely going to want to call your pet's usual veterinarian if you see tan, gray, or white feces. And then there's a variety of other colors, and they can all indicate problems in their GI tract or changes in diet. So definitely contact your pet's veterinarian if you see any colors other than brown. This table is useful for assessing your pet's poop's texture or consistency. It's the most widely used chart in veterinary medicine, and it's a very handy tool when you're describing your pet's poop to their usual veterinarian. Just give them a fecal score from 1 to 7. Scores 1 through 3 are typically normal for cats, and scores 3 through 5 are typically normal for dogs. Just know what's normal for your pet, note any changes, and let their usual veterinarian know if it's abnormal for longer than 24 hours. Feces that are hard, dry, and difficult to pass, usually a score of 1 to 2 for dogs, can indicate dehydration or constipation. Make sure you always leave out fresh, clean water to prevent dehydration, which can be one of the many causes of constipation. Call your dog's usual veterinarian if you suspect constipation. Feces that are soft, wet, and shapeless, so a score of 6 or 7 for dogs and 4 through 7 for cats, can indicate illness or diarrhea. Diarrhea, especially if it goes on for a prolonged amount of time, can cause dehydration. Call your pet's usual veterinarian if you notice any signs of diarrhea or soft stool lasting longer than 24 hours. Seeing a slimy, mucus-covered stool can indicate illness or infection. Call your pet's usual veterinarian if you notice mucus in their feces. And if you see small white pieces that look like grains of rice in your pet's poop, this might indicate that he or she has a parasitic infection. Definitely take your pet to the veterinarian if you notice rice grains in their stool. All poop smells bad. It's poop. So get to know what your pet's poop normally smells like and definitely note any changes. If your pet's poop smells abnormal, it's usually going to be stinkier than it normally is. So stinky poop can indicate usually changes in diet. So if they've maybe changed their diet, or if they've had a lot of treats recently, or maybe they got into the trash, this can cause really stinky poop. Make sure if the really stinky poop is accompanied by other changes, like changes in color or consistency, that you're going to want to call your pet's usual veterinarian for this so they can rule out what it might be. All pets' poops are different sizes, so just like the difference between a Chihuahua and a Great Dane, they're different dogs. They're going to have very different sized stool. So get used to how large or small your pet's poop usually is and note any changes. Abnormal poops are usually going to be either larger or smaller than usual. So it could be based on a variety of factors. Sometimes a diet change can cause smaller or larger poops. But let your pet's usual veterinarian know if a large or a very small stool is noted accompanied by other changes, like changes in consistency, color, or anything else. Most pets poop at least once a day, and for some, 3 times a day is completely normal. Some abnormal indications might be if your pet is going too often. So 4 or more times a day is usually pretty abnormal, and it can indicate some motility problems possibly. So you're going to want to call your pet's usual veterinarian if they start going more often than usual. And again, if this is accompanied by other changes, like changes in color, consistency, or smell, you're going to want to note that and let the veterinarian know, as this could indicate some disease processes as well. If your pet's not going often enough, you're definitely going to want to call their usual veterinarian, especially if they haven't pooped in more than 24 hours, because this can indicate constipation, and that can become very serious if it goes untreated. If your pet is straining to poop, or if they're lethargic or have behavioral problems, you're definitely going to want to note this as well and go see their usual veterinarian. If your pet is normally house trained or litter box trained and they start having accidents, you're definitely going to want to call their usual veterinarian if the accidents happen more than once. So sometimes this can indicate things as simple as stress or a change in routine, but other times it can indicate incontinence or disease as well. So you're going to want to speak to your veterinarian and go visit them and see what they can rule in or out. Thank you so much for watching this quick tips video on assessing your pet's poop. Don't forget to like, subscribe, and share with your friends. Check out that video's description below for the resources that I used for this video, as well as a bunch of extra reading material for you about inflammation in the GI tract, constipation, and diarrhea in small animals. You're also going to want to go visit my website, feedingravendoodles.com, where I have all my articles and videos in one place for you. If you have any questions, comments, or suggestions for future videos, leave a comment down below as well, and I will totally get back to you. Next time, we're going to be talking about nutrient requirements in dogs and cats. Say bye, Raven. She's sleeping. She doesn't want to wake up.